you. Thank you. Thank you, thank you. Well, what a great room to be in tonight, and for all kinds of reasons. I can tell you it's good for my mental health. I want to start by thanking Patrick Kennedy, who, as Chris Matthews has already said, was a terrific representative for Rhode Island and then an absolutely outstanding member of the United States Congress. But there's no doubt in my mind that we would not have a mental health parity and addiction equity law or the Affordable Care Act without Patrick's leadership and perseverance. So thank you, thank you, thank you. And what a remarkable family legacy. How many sons get to work with their father on such an incredible change in America? Along with Senator Kennedy, the conviction and imagination and leadership fighting for health care for all. And as he used to say frequently, the state of a family's health should never depend on the size of a family's wealth. And there's no question that we're in the right place tonight to talk about these two pieces of historic legislation, but more than that, as you will do all day tomorrow, to talk about how that legislation comes alive in communities across this country and how it will empower and transform people's lives. I do want to recognize that we have, as Patrick already said, some great HHS health leaders here, not only from our Office of Substance Abuse and Mental Health Services, our Disability Office, the Agency for Planning and Evaluation, great researchers from NIH. We want all the assets of the department to be at the table for this critical discussion. And it's a great pleasure for me to spend a portion of the evening with our wonderful Vice President, Joe Biden, who clearly is an incredible national leader on all of these issues, and you'll get to hear from him in a few minutes. I don't think there's any question that, as Patrick said, we need to take a new approach to mental health care. Refocusing on active, high-quality treatment, shifting the orientation of care from institutions to community-based settings, integrating more people living with mental illness and intellectual disabilities into mainstream of American life. That's kind of the framework that President Kennedy laid out 50 years ago. It remains a challenge today. We have made some progress, but I would say we're on the edge of historic progress with the leadership of President Obama and Vice President Biden. They have put a new national focus on prevention, on treatment, and on support for Americans in recovery. Now, I've had my own situation in the last 6 months where two people very close to me experienced crises. Both of them were able to receive help and support because they had resources and they had friends and they had family to turn to. But it wasn't easy in either case. It gave me a real snapshot into some of the challenges in both our mental health and substance abuse systems. The handoff from crisis to stabilization to community support is not only complicated, in some cases it's very rocky and people definitely fall through the cracks. The coordination wasn't really coordinated. And I'm the Secretary of Health and Human Services. I know who to call. I know where the resources are. So if our friends and family had difficulties, I got a real snapshot into what people in communities deal with every day. I have an amazing array of caring experts to call on. But beyond the personal toll this takes on families and individuals, it takes a huge toll on our country, and we have to help individuals receive and achieve the promise of recovery. 9 in 10 Americans right now with substance use disorders don't receive care. 9 in 10. 60% of Americans living with a mental health condition don't receive care. And as Patrick said, that's where the tragedy lies. Year after year, we lose more than twice as many Americans to suicide as we do to homicide. Every year. Now, these are our moms and dads, they're our sisters and brothers, our kids, our grandkids, our friends and neighbors. So I want to tell you a few things that are going on. To save more lives, we're part of the National Suicide Prevention Strategy, and I also want to thank Senator Gordon Smith and the terrific work he does in leading a number of efforts. But the National Action Alliance has been launched, and we're very much a part of that. We're taking steps to meet demands for mental health and substance abuse treatment services for veterans, service members, and their families. Now, those efforts have an amazing team of First Lady Michelle Obama and her great partner, Dr. Jill Biden, at the head, and that is a very important spotlight to shine. At HHS, we've joined with foundations and health providers, faith leaders, and advocates to work on an effort around bullying prevention. If you think about kids being in a safe place, kids feeling like they can reach out for the help they need, this is an important part of the puzzle. And we're announcing today a new $57 million Safe Schools, Healthy Students grant, because we have to start with some of our youngest students. The President has proposed a new initiative, a $130 million initiative to create job opportunities and to support so-called mental health first aid, which we know works, which helps identify and get help to students who show early signs of mental illness and make sure that they get into preventive care very quickly. At the end of the day, our success really depends on our ability to move hearts and minds, and that's part of the national dialogue that's going on in communities around the country right now, led by Pam Hyde and her team, and it's really a remarkable coming together of people to look at the gaps at the community level. Now just think for a second how different things would be if everyone felt like they could access treatment without the fear of being judged. Imagine what it would mean if people felt as comfortable saying they were going for counseling as they were going for a flu shot or physical therapy. Ultimately, the efforts around legislation are for naught if people aren't able to access the services they need. So the Parity Rule and the Affordable Care Act will expand and protect behavioral health benefits for 62 million Americans. 62 million Americans. That's by far the largest expansion of behavioral health coverage in a generation. And Patrick, I need to tell you that we are still on track, in spite of the shutdown, to get the final parity rule out in the very near future. The rule entered its final stages of review on Monday, so it's close. It's very close. The Affordable Care Act also expands access to a number of preventive mental health services, including screenings for alcohol abuse and depression, and behavioral assessments for children, all without copays and out-of-pocket fees, recognizing that identifying symptoms early, getting people helpful strategies is incredibly important. The new law prevents ever again insurance companies denying coverage based on pre-existing conditions like bipolar disorder or depression. That's a huge step forward for millions of Americans. And many of the 7 million newly insured young adults who can now stay on their parents' plan until age 26 are in that critical age group. We know that 3/4 of mental illness occurs by the age of 24. So the uninsured population who is under 30 is a key target group. We need to make sure they get access to the services they need. The law also builds on the progress we're making with the money follows the person's incentives, giving more Americans living with intellectual disabilities the flexibility to make their own choices, to choose less restrictive home or community-based settings, and make sure that the support services are there for them. So, as Patrick said, on October 1st, a new opportunity opened for the 15% of Americans who have no health coverage at all, or who are in and out of the so-called individual market, which has not provided much protection. And as the President reminded the American public on Monday, the new law is more than a website. It is an opportunity for millions of Americans to obtain mental health, and physical health services. No one ever again will be denied coverage based on a pre-existing condition, mental or physical health. The new law is also working to lower prices and increase competition and expand mental health services. So we're here half a century after President Kennedy called for a wholly new national approach. And we find ourselves once again at the crossroads of history. We have a very real opportunity to improve, and in some cases save the lives of millions of our friends, our neighbors, and our family. You in this room will strategize over the course of the next 24 hours, come up with specific strategic ideas and results. We look forward to being a great partner in that and to be informed by that. You have partners and allies in this administration who are mobilizing our assets and our resources to take advantage of this historic opportunity. We need an all hands on deck, and our hands are on the deck. We need your partnership. We need the Kennedy Forum. And again, I want to thank Patrick for the work he's doing to push this effort forward. Thank you very much.